from the rain.
Good afternoon, everybody. Today I'd like to present my research paper. The topic is the development of a communicative instructional model to reduce behavioral problems in preschool children with autism in Thai context. So we know autistic children have the three main features. First is impairment to social interactions, impairment in verbal and non-verbal communication, and repetitive patterns of behavior. You see, wait. These pictures, although the children play in the same ground, but they also separate playing. They not play each other. They have the problem of like interaction to play with each other. Next. Why I do this research? Because of my background is working in speech clinics, training like speech pathologists, and I'm working in a nurse positions. And I want to develop the communicative instructional model to help the patient and the children who have the problem of speech and language delay also. And I choose the children with autism to be my sample. That you see, the communication is the whole of the language and speech. If you cannot communication with each other, so when I stand by here, if I like an autistic student, what you want to know, I cannot express what I want to do. So I will have the behavioral problem such as tantrum, or when I want something, I will hold your hand and throw you or something like that. It will have the problem behavior appear if you don't have communication with other people. So in the traditional training in speech clinic, I use apply teach approach and have like conditions for training children and training the children with oral rehabilitation. Some of children have the problem of apraxia of speech. They cannot speak the word. The real word that he wants to speak. And why I try to develop this model, because of the autistic children have the problem of hyperactive and not ready for the program in the clinic, and some of them have non-verbal. So I developed a new model. It's called alternative communication. I use integration between picture exchange communication, ABA analysis, and treatment and education of autistic and related communication handicap for children teach. And research question is how does a communicative instructional model contribute in reducing behavioral problems in preschool children with autism? And second, does a communicative instructional model reduce behavioral problems in preschool children with autism? And its purpose, to develop an active and effective communicative instructional model to reduce behavioral problems of children with autism, and second, to access the flexibilities of a communicative instructional model to reduce behavioral problems in preschool children with autism in Thai context. And the variable is a communicative instructional model, and dependent variable is behavioral language level and behavioral problems. This is the model composed with ABA, teach, and PEG to integrate each other. ABA, I use discrete trial, and teach, I use structural and PECS, picture exchange communication, to develop a new model called PAT model. Use the first letter of a PEC, P from PEC, A from ABA, and T from teach. Next. This is the setting that when the children work with me, they must finish their task. Wording is present from the left to the right side, and I use the visual schedule. This is the transitions for them to finish their work. The blue one is mean start to work, and green mean go, and yellow almost finished, and red stop. It's like traffic light to be finished his task. So next. ABA, I use this with trial. It's composed this criminal stimulus, prompting stimulus, response reprocessing stimulus, and inter trial to follow the step. This is PECS. Have you teaching the children with PECS in your school? Yeah, it's well known, right?
Yes.
And PECS is have 6 steps, but in this research I use only 4 steps. The first step is how to communicate, communication with other people, to learn how to exchange the pictures and communication. And step 2, distance and persistence, is to use the distance to work and exchange the pictures with other people what they want. And step 3, picture discrimination. They will describe the picture 2, 3, 4, and many pictures to make more perception and understanding in language. And step 4 is sentence structures, to use the word and compose the picture to be a sentence, what they want, such as I want milk, something like that. Next. And teach techniques I use structure is physical organization, task organization, visually organization, and work system. This is the calendar. We will show the visual and the follow step 1, 2, 3, 4. That the children will know what we'll do next. And this research, I have 3 phases. It's like a small research in each phase. Phase 1, I use contextual study and case study. The phase of need assessment and behavioral problem in language of children with autistic investigation. I found that the problems behavior, they have transient cell stimulation. It's like the characteristic of the autistic children. And they have also problem of communicative disorder, non-speaking, or some of them can speak but have aplasia of speech, that you cannot speak what you really want to say. And phase 2, I start to develop the model and try out this model. To develop model consists 6 steps. I use like integration in the many knowledge. It's called like interdisciplinary knowledge. Because of my background is nursing and educational psychologist, and work in a speech clinic, and also focus on special education. So it's not only one knowledge to use. And I call this model is PAT, to be a new name, Pictures Application for Teaching Model. And phase 3 is a complicated instructional model implementation. After I develop this model, PAT model, I use pre-test and post-test design was employed exam develop model effectiveness for 20 preschool autistic children, and the age of the children is 3 to 6 years. Use experimental group 10 and control group 10 of each. And I have to give them interventions for 30 minutes weekly station, 3 months long training program. Under development model was implemented in the experimental group. Meanwhile, the control group used traditional training. This is the language assessment form. It's assessment both receptive language and expressive language with 12 items. Cooperation with adults until social interactions. This is the material of PAT model that I made by myself. That it's so expensive to buy the material from America or overseas. So to make it easy, I will find the picture with Google. It's so many pictures that I bring also. And this is the schedule that I use for training children that have transitions blue, green, yellow, and red for finish the task. Next. And this is my favorite potato heads. All the children love it. And yeah, and in Thailand we doesn't have potato heads like this. So every time when I came here, I always buy it. So many potato heads. Yes, okay. Yes, and all children love it a lot. Next, and my research is finding behavioral language score for the first test of the subject is higher than pre-test. And moreover, behavioral language score of subjects in the experimental group was higher than the one's control group. And the children can able to communicate what they want and able to show the picture in composing the sentence to communicate so that the behavioral problem will decrease. This is the graph that shows experimental group and the control group. You see in the experiment group it's like high, dramatically high after I give them interventions. At the same time, in control group, they also high, but it's not much. And the children can able be longer to their task, able to handle their task more systematic, and finally able to independently import picture to communication without prompting. Yes. So, seeing my video, you will understanding all of the things that I done in my research. I don't want to make you so serious. That is the music video.
Development disorders are currently used synonymously to refer to a wide spectrum impairment in verbal and nonverbal communication, and restricted and repetitive pattern of behavior. At present, it is not exactly clear why some children fail to acquire language. However, it is clear that if language does not develop in a timely manner, it is reasonable to expect that various forms of inappropriate behavior or behavioral problems might occur. Most nonverbal or language-delayed children have some type of behavior problem. For example, tantrums, self-stimulation, property destruction, aggression, social withdrawal. And it is often easy to see how these behaviors come to function as the child's main form of communication. Serious misbehavior in children with autism should be replaced with socially appropriate behavior. Communication difficulties can be a primary reason for many behavior problems. Because of the nature of autism and the many combinations of symptoms that may be present, there is no single approach that has been shown to take away all symptoms of autism. Various types of therapies are available, including behavior training and speech therapy. It is important to develop life skills for children with autism. Tasks that enhance independence give more opportunity for personal choice and allow more freedom in the community, which are especially valuable traits.
Assistant. From the
A good program will also incorporate training and support systems for the caregivers. Though no single approach can take away all the traits of autism, many behaviors can be positively changed with appropriate intervention.
many choices from here.
The specific models that may be chosen vary from person-focused, family-centered, and community-based model approach. There are two major groups of visual strategies: those that rely primarily on movement, gestures, and those that involve external materials, PECs, and teach. Visual strategies also help children with autism develop functional life skills, for whom simply moving through the day is a challenge. Traditional verbal prompts such as time to clean up and go outside often are not effective with children with autism. Creating a visual schedule helps children with autism make the transition from one activity to another. Visual schedules include a sequence of drawings or pictures which include the order of activities for the school day or home routine. This method focuses on the child's visual strengths and often can improve a child's ability to function independently. Applied behavior analysis, ABA, and other behavioral approaches are based on the theory that all behavior is learned and that it is governed by antecedents and consequences. The foundations of this are that learning can be reduced to the repetition of responses, which increase with reward. In this way, a task to be learned can be divided into small steps that are then used as a teaching program for the child. Each step can be shaped through positive reinforcement. There is a neuropsychological basis of autism, and this is what must be addressed. A customized program based on the child's needs, skills, and interests will be most effective. Develop a communicative instructional model to reduce behavioral problems in preschool autistic children in a Thai context. This model is a synthesis to draw from and combine techniques used in Picture Exchange Communication System, PECS, Applied Behavior Analysis, ABA, and Treatment and Education of Autistic and Related Communication Handicapped Children, TEACH. I have named this model PATH, using the first letter from each technique adopted. The PATH model has been designed to be an integrated and comprehensive model with a sequential and logical process to move from assessment to educational programming, and from less sophisticated to more sophisticated goals.
And it's cold, and it's dark, and you don't have a clue. There's a wall in your heart that no one can get through. And it's cold, and it's dark, and you don't have a clue. But this wall, it will fall, and it's the last thing I do. I'll get through. Wall in your heart.
That's all.
Really good. We have 15 minutes for questions, comments, for discussion. Anybody for a new topic? I had a comment about your differentiated instruction. For English language learners, we have been using sheltered instruction, and this, is almost similar in terms of, teachers making that adjustment, and that goes a long way in making learning happen. That's what we all want to do. So this is very interesting. I learned a lot from that. Thank you. It's not a question, but it's really fascinating.
I have actually a couple of questions for you. The first one was, I wanted to make sure I understood clearly. Did the children only have 30 minutes per week? Just one 30-minute session?
Because of Thailand, they have speech of pathologists only 40 or 50.
Yeah.
Yeah, and I was training my speech pathologist to help the speech pathologists, and I work in the central of the hospital that all of the part of Thailand, northeastern of Thailand, they come to the hospital. So they don't have staff anymore. Yeah. So I training them for 1 week and then training the patient, the parents also.
Okay.
Yeah.
Yes. And one other thing, you said that the control group improved much more than, the experimental group
yeah.
improved much more than the control group. Was it statistically significant? Was it, you know, the degree of improvement? That's what I wondered about.
Oh, it's significant because of the parent also report that their child is improved and record every session.
So,
yeah.
So parents gave feedback, and then you observed, or some others who were working?
Both, yeah.
Right.
Parent observe and report
Right.
that their children behavior, and I'm checking in the video record also.
So you have a video to
Yes.
get your data from?
Yes.
Thank you, that's helpful to me.
It seemed like when I was looking at the control group and trying to compare for the two data sets, that there was a lot more variation in the control group than in the experimental group. It like went down, up, down.
Yes, yes. Some of them can speak, but some of them cannot. Because of the problem of children with behavior, they have like 3 features: problem behavior, and some of them have the problem of like seizure. So sometimes that make that problem severe. It's not stable.
Noah, I would like to ask you a question, if that's okay.
Yes, of course.
It's about learning to be an instructor that uses differentiated instruction.
Yes.
What does it take to learn? How long